Imagine this, a seemingly normal Monday morning. You're sipping coffee, planning your week. Then, a sudden, fleeting shadow crosses your vision, like a tiny flicker of static in your peripheral sight. You rub your eyes, it's gone. You dismiss it. Just stress, you think. 1 week later, you're rushed to the ER, the victim of a catastrophic stroke that has paralyzed half your body, stolen your speech, and changed your family's life forever. The shocking truth? That fleeting shadow? It was your body's final, desperate warning, and you missed it. A massive study from the American Stroke Association reveals a terrifying statistic. 9 out of 10 Americans are completely unaware of the silent, subtle warnings their body sends before a major stroke hits. We are masters at recognizing the classic FAST signs: facial drooping, arm weakness, speech difficulty, time to call 911. But by the time those signs appear, the damage is already underway. You are in the acute attack phase. This video is not about the attack. It's about the pre-attack. It's about the hidden, almost ignorable signals your brain sends up to 7 full days before a life-altering event. We've synthesized groundbreaking research from institutions like Harvard Medical School, the Mayo Clinic, and the National Institute of Neurological Disorders to bring you what no one else is talking about: the 3 silent stroke warnings. If you or a loved one is over the age of 50, has high blood pressure, or a family history of heart issues, this information is not optional. It is your ultimate defense. Today, we will reveal these 3 silent alarms, explain the complex neurology behind them, and give you a precise 60-second action plan to implement the moment you recognize one.
Stay with us, because knowing this could literally be the difference between a full recovery and a life spent in therapy. Let's start by defining the battlefield. When we talk about stroke, we are primarily talking about 2 types. The most common, accounting for about 87% of all cases, is the ischemic stroke. This is a plumbing problem. A blood clot blocks an artery, cutting off blood and therefore oxygen to a part of the brain. The other type is the hemorrhagic stroke, a catastrophic bleeding problem where an artery ruptures, flooding the brain tissue. Both are deadly. But before either of these main events, there is the precursor, the transient ischemic attack, or TIA, the mini-stroke. A TIA is when the blood supply is only briefly interrupted, causing temporary symptoms that usually resolve within minutes, but almost always within 24 hours. Because the symptoms vanish, most people, and tragically even some medical professionals, dismiss them as nothing more than a fleeting ailment. This is a fatal mistake. A seminal study published in The Lancet tracked thousands of patients and reached a terrifying conclusion. A TIA is not a standalone event. It is a 90-day time bomb. The study found that nearly 50% of major strokes occur within 48 hours of a TIA, and a staggering 80% occur within the first 7 days. This means that the subtle symptom you experience today is likely your last best chance to intervene before the massive stroke occurs next week. The goal is to recognize the minor symptoms of TIA that you might confuse with a migraine or a dizzy spell. Here are the 3 silent alarms that demand your immediate attention within that critical 7-day window. The first silent warning is often the easiest to ignore because it feels like a simple eye problem. We call it Amaurosis Fugax, or as patients describe it, a curtain descending over one eye. This is not blurry vision due to needing new glasses. This is a complete or partial loss of vision in one eye, lasting anywhere from a few seconds to a few minutes. It feels like a blackout, or as if a shade has been pulled down, and then just as suddenly, it slides back up. The neurology behind it, this symptom is directly linked to an ischemic event in the ophthalmic artery, which supplies blood to the retina. The clot that causes this temporary blockage has often broken off from the carotid artery in your neck, the main highway to your brain. When the vision clears, it's not because the problem is solved, it's because the clot has temporarily broken up or moved. But this microembolism is a flashing red signal that your carotid artery is unstable and potentially on the verge of sending a larger, more permanent clot to the deeper regions of your brain. Data insight. The New England Journal of Medicine highlighted that patients presenting with Amaurosis Fugax have a 91% higher risk of a major stroke within the following 3 months if the carotid artery is compromised. What distinguishes this from a migraine aura? A migraine aura typically involves shimmering zigzag lines or flashing lights, and usually affects both visual fields, not just one eye. The key word for stroke is darkness, and it is unilateral, one eye only. The next time you experience any loss of vision in a single eye, no matter how brief, do not wait. This is not an appointment for an optometrist. This is a 911 call. Sarah, a 63-year-old retired teacher, ignored the static in her eye 4 times over 6 days. Her stroke was prevented only because her daughter finally insisted she go to the ER. The diagnosis? 85% blockage in her right carotid artery. The visual disturbance saved her life. The problem is, our vision is so adaptive, we often overlook these quick flashes. Train yourself. If the light goes out in one eye, your brain is sending you a critical message. The second silent warning is frequently mistaken for inner ear issues, low blood sugar, or just being clumsy. It is sudden, unexplained vertigo or severe loss of balance. I am not talking about feeling lightheaded when you stand up too fast. I am talking about an intense, debilitating sensation that the room is aggressively spinning, forcing you to grab onto something to avoid falling. Crucially, this type of vertigo, when stroke-related, is often not accompanied by ringing in the ears or significant hearing loss, the hallmarks of benign inner ear disorders like BPPV or Meniere's disease. The neurology behind it. When this symptom points to a stroke, it's typically a blockage occurring in the brainstem or the cerebellum, the back portions of your brain responsible for integrating sensory input, coordinating movement, and maintaining balance. These areas are supplied by the vertebral arteries. A clot here, even a small, temporary one, can completely disrupt your ability to orient yourself in space. This is the most challenging silent warning because millions of people experience common vertigo. However, the stroke-related vertigo is typically sudden and unrelenting at the onset. It doesn't build gradually. It hits you like a brick wall. And critically, it is often associated with the inability to walk a straight line or suddenly falling to one side, truncal ataxia. A landmark study from the Mayo Clinic emphasized the HINTS exam for doctors to distinguish between benign and stroke-related dizziness. While you cannot perform the full HINTS exam on yourself, remember this rule. If the vertigo is so severe that you cannot stand or walk, and it appeared out of nowhere, you must suspect a posterior circulation stroke. Focus on the loss of coordination. Can you touch your nose with your finger with your eyes closed? Can you stand with your feet together? If the answer is no, and the onset was sudden, you may be in the 7-day window. Many people who experience a posterior TIA wake up the next day feeling fine and cancel their doctor's appointment. By doing so, they are actively allowing the clot that caused the problem to build up its forces for a much larger permanent attack. Do not let that be you. Immediate brain imaging is required. The third silent warning is the most alarming, as it is often a direct precursor to the most devastating kind of stroke, the hemorrhagic stroke, or bleeding in the brain. This is the sudden, unprecedented, severe headache, the thunderclap. This is not your average migraine. This is not the stress headache you get after a long day. This is an explosive pain that reaches its maximum intensity in less than 60 seconds. Patients describe it universally as the worst headache of their entire life. This kind of instant maximum pain is typically caused by a rapid increase in intracranial pressure. In a stroke scenario, it is often the direct result of a subarachnoid hemorrhage, or SAH, where blood is rapidly released into the space surrounding the brain, usually from a ruptured aneurysm. The pressure on the surrounding nerves and tissues is what causes the immediate blinding pain. How do you know this isn't just a migraine? 1. Speed. Migraines build over minutes or hours. The thunderclap is instant. 2. Intensity. It's the maximum pain you have ever felt. 10 out of 10. 3. Accompanying symptoms. Thunderclap headaches are often accompanied by severe knuckle rigidity, vomiting, and an immediate altered level of consciousness. A typical migraine is not. 4. Family history. If you have a family history of aneurysms, this warning is 10 times more critical. Johns Hopkins research. Research confirms that even a minor temporary bleed, which causes a less severe but still instantaneous headache, can be a warning leak from a larger unstable aneurysm. Up to 40% of patients who experience an SAH report a milder, sentinel or warning headache in the preceding weeks. The immediate action for a thunderclap headache is non-negotiable. You must assume it is a massive bleed and call 911 immediately. Do not wait to see if it improves. In this scenario, seconds determine your survival and your long-term cognitive function. Remember, this is a massive bleed, and it will not resolve itself. It requires emergency surgical or interventional treatment. We have covered the 3 silent alarms: visual disturbance, vertigo or balance issues, and the thunderclap headache. Now, let's talk about the absolute non-negotiable actions you must take if you or a loved one experiences any of them. Knowledge is only power if it leads to action. In the event you experience a TIA or any of the 3 silent warnings, your first 60 seconds of action determine the next 60 years of your life. Step 1. Call 911 immediately. Do not call your doctor, your spouse, or your neighbor. Call 911. Do not wait to see if the symptoms pass. If you experience a visual flicker that disappears in 30 seconds, you are in the 7-day window. The emergency is not the symptom. The emergency is the unstable clot threatening your brain. Step 2. Use the lying technique. When you call 911, your priority is to get the ambulance there fast. Do not say, "I think I had a little dizzy spell." You must report the most severe, classic stroke symptom to bypass the dispatch queue. Say this: "I am having sudden, severe weakness on the left side of my body and my speech is slurred. I need an ambulance now." This activates a priority dispatch. Step 3. Prepare your information. If you have a medical alert card, hold it. If not, know where your medication list is. Paramedics need 3 things immediately: your location, your medications, especially blood thinners, and when the symptoms started. Step 4. Assume the position and wait. Sit down immediately, propped up at a 45-degree angle. This is the semi-Fowler's position. It reduces the strain on your heart and makes breathing easier. Do not take an aspirin yet. Only a doctor can determine if your stroke is ischemic, which needs aspirin, or hemorrhagic, which is fatal. Wait for the medical team. This 60-second protocol is your bridge to professional medical intervention. Remember, you are not waiting to see if you get better. You are waiting for the team that will prevent the major stroke. The best treatment for a stroke is the one you never need. A full 80% of strokes are preventable through lifestyle modification. If you have recognized the silent warnings, you now have the greatest gift, the chance to change your future. 1. The silent killer, blood pressure. High blood pressure is the single greatest risk factor for stroke. It damages your arteries over time, leading to clots and increasing the risk of rupture.
The latest American Heart Association guidelines are clear. Keep your blood pressure below 130/80 mmHg. If you are not monitoring your BP daily, you are flying blind. Invest in a quality arm cuff monitor and use it every morning. 2. The cholesterol-sugar connection. High LDL, bad cholesterol, is what creates the plaque in your arteries, the foundation for the clot. Simultaneously, uncontrolled diabetes, high blood sugar, causes chronic inflammation that eats away at the blood vessel lining. The solution is holistic. Focus on a Mediterranean or DASH diet, rich in vegetables, whole grains, and healthy fats, and low in processed sugars and red meat. 3. Move your body, save your brain. You do not need to run a marathon. Just 30 minutes of moderate intensity exercise 5 days a week reduces stroke risk by over 25%. This includes brisk walking, gardening, or swimming. Exercise improves circulation, lowers BP, and helps maintain a healthy weight. 4. The no-smoke rule. Smoking doubles your risk of an ischemic stroke and significantly increases the risk of a hemorrhagic stroke. Nicotine constricts blood vessels, and the toxins damage the vessel lining. There is no such thing as a safe amount of smoking. You are now armed with knowledge that 90% of your fellow Americans do not possess. You know the 3 silent alarms: the visual curtain, the sudden vertigo, and the thunderclap headache. Do not be the 89% who freeze. Be the 11% who act decisively. These warnings are your body's second chance. Honor that warning. Make that call. Take control of your health. Now, we want to hear from you. Have you or someone you love ever experienced a silent warning that was missed? Comment below and share your story. What is one small step you will take today to reduce your stroke risk? Your experience might just save a life. Thanks for watching.